Population and development are intimately connected. People are the targets, the planners, the builders, and the movers who work to make development happen. Development is meaningless if people, the population of a nation, do not have a say in how it is pursued or how they can participate in efforts to make it possible. It is without value if they cannot get their rightful share of its benefits, since people are its most important beneficiaries. This interplay between population and development is what PCPD, or the Philippine Center for Population and Development, is all about. Originally called the Population Center Foundation, it was created in 1973 when the country was experiencing high fertility rates. It implemented projects that complemented government's national population program.
Suddenly, when you become First Lady and Mother of a country, you take care of everything. Everything is a priority. And the first priority are human beings. And then, of course, it's an overpopulation. Even if we needed a lot of development, and there was a debate between what would go first, population control or development, well, it had to be balanced.
Grants from the national government and donors, such as private corporations, embassies, and foreign aid agencies, funded PCF's operations.
PCF was actually set up as a complement to the Population Commission, which is, as you very well know, is a government institution. This would be a private sector initiative which would then be able to generate resources freely and more independently than government.
For the next 2 decades, PCF developed and implemented new projects and strategies that delivered population and health information, education, training, and services. For most of this time, it was led by Dr. Conrado Lorenzo, its first executive director.
He has also been the good manager, but he's also a visionary. We were able to develop a good, credible name during his, that started in his term and is being continued today.
In 1992, PCF was renamed the Philippine Center for Population and Development. This reflected the shift of its focus from population concerns, especially family planning and fertility reduction, to population and development, or PopDev. Toward the end of the 90s, grants from donors were starting to dwindle. PCPD remained unfazed. After all, its trust fund was gradually increasing, and it was earning income from the rental of its building. Instead of seeing the situation as a setback, PCPD considered it an opportunity to reinvent itself.
We worked with institutions, we worked with local governments, we hoped. We worked with consortia, sometimes universities working with the local government. So these were the kinds of, and sometimes we worked with individuals who had led population programs in smaller communities, and the idea was that this could be models that could be replicated elsewhere. So the fact that we became a grant-giving institution enabled us to do a number of things, which if we were just implementing it ourselves out there with our from our offices would be tougher.
The reorganization caused birth pains for the foundation, but it also opened a new direction for growth and for meaningful engagement with its partners. Today, PCPD remains as one of the few organizations that is focused on PopDev concerns. A number of the projects it implemented and supported have left their mark and have contributed significantly to developments in their fields. In the process, they have successfully bridged the shift from being innovative models into viable endeavors. There was the Health Resource Distribution Program. It mobilized nursing and medical students to provide services on primary health care to poor or remote communities as part of their training. Endorsed by the Commission on Higher Education as a concrete model in integrating primary health care, it was made a key part of the standard 2-year curriculum for all health-related courses of nursing schools and medical colleges. PCPD was already promoting responsible parenthood back in the 90s through its program on responsible parenthood and maternal and child health for industrial workers. Here, family planning was presented to industrial workers as an aspect of responsible parenthood, together with maternal and child health and nutrition. The project institutionalized an in-plant responsible parenthood initiative involving management, unions, and workers. Young people have always been a main target of PCPD. It pioneered the setting up of a multi-service youth center in the late 80s. These youth centers were launched in Manila, Cebu, and Baguio to respond to the health and sexuality concerns of young people, especially the out-of-school youth, teenaged mothers, and other young people going through crisis in their lives. Considered a trailblazer, it provided personalized counseling on a wide range of problems faced by young people. The youth center set up in Manila eventually became the Foundation for Adolescent Development, best known for its Dial-a-Friend phone hotline for troubled youth. The Baguio Youth Center is still providing health services and information, as well as values education among young people in that city. Together with the then Department of Education, Culture and Sports, PCPD developed 4 resource manuals on the growing Filipino adolescent. They were used in the revitalized homeroom guidance program for public secondary schools. Teachers were also trained on how to teach the modules. The program was implemented not just in public schools, but in all private high schools, technical and vocational schools. Years later, another innovative project set a standard in teaching PopDev education. This was spearheaded by the Office of Population Studies of the University of San Carlos. The modules are a product of a series of nationwide forums on PopDev and in consultation with religious educators to help fill the gap on sexuality education that incorporated Catholic values. Published as the Population and Development Education Teaching Modules for Catholic Schools, they are now used by selected public schools. The modules have been translated into video to be aired by the Knowledge Channel. These will be made accessible to some 2,000 public schools nationwide. To reach out to more young people through social media, PCPD supports the Mulat Pinoy project of Probe Media Foundation. It delivers information on PopDev to the general public, especially the youth, and it uses social media extensively. Another of PCPD's strengths is its commitment to elevate the population discourse into a more scientific and objective level. It is done through studies, discussions, and forums where the results and findings are used for policy advocacy and planning, particularly at the local level. It funded a series of studies on the population and poverty nexus by the Asia-Pacific Policy Center. PCPD supported an experts' roundtable discussion initiated by the Likhaan Center for Women's Health to clarify conflicting opinions on the so-called abortifacient and carcinogenic effects of contraceptives. The discussion happened at a time when accurate, scientific, and evidence-based information was needed to counter the myths and disinformation going around as an offshoot of the debate on the Reproductive Health Bill. Implementers also used them as reference in planning their own interventions on pop-dev concerns. In all its endeavors, PCPD worked with a whole range of partners, with other civil society organizations, with the academe, with legislators and local officials, with business groups, with youth advocates, with international organizations, and with media. Recently, it started working with faith-based organizations to introduce the concept of PopDev to them and develop their own PopDev projects.
As an advocacy organization promoting population and development, PCPD looks at sustainability differently. For us, it is generating an idea to blossom and to stay alive in the minds of people and to inspire action. Our program strategy is not to let go of any initiative, but to nurture it, to get cues from people, and to allow it to evolve into action for which we can provide funds.
PCPD continues to thrive, and thrive well, as it enters its fourth decade. Because it has limited reach and resources, it continually reviews and adjusts its thrust and strategies. With the guidance of its Board of Trustees, it has judiciously managed its limited funds to sustain its operations and finance its programs. It has built a broad-based network of donors, partners, and advocates for PopDev. This is done so that the projects it supports are relevant and able to bring long-term improvements to the lives of their beneficiaries.
I would say that our principal focus should be, number one, on the young, the students, and number two, on the poor, especially the poor communities who may need different approaches as we assess the effectiveness of different approaches from our studies. Another direction that I would endorse is for PCPD to tap more into ASEAN knowledge, ASEAN ideas, ASEAN experts. It's quite clear that they have been successful, in Indonesia, in Malaysia, in Thailand, and even in Vietnam, to improve their economic growth because the level of fertility has come down so that the economy has a chance to flourish and the poorer families have a chance to educate their children better.
At the core of development is people and the informed decisions and actions they make to live an improved life. The kind of life that realizes their dream for a more prosperous, just, and sustainable world. The kind of world that is PCPD's reason for being.